Okay, hello everyone. My name is Ria Suarez with the Cancer Support Community, and I'd like to welcome you all to our webinar, Frankly Speaking About Cancer Melanoma, Managing Out-of-Pocket Costs, which is hosted by the Cancer Support Community in partnership with AIM at Melanoma, Melanoma International Foundation, Melanoma Research Alliance, and Melanoma Research Foundation. This program is sponsored by Merck. Before we start, I'd like to go over some reminders and just some housekeeping items. Today's event is being recorded and will be made available on our website at cancersupportcommunity.org/webinars. For this webinar, our presenters will be featured first, and then we'll move into our question and answer session. At the end of the webinar, you will be redirected to our post-webinar survey, which is a brief survey, and we greatly appreciate any feedback that you have for us. So I'd like to give some background and talk about the mission of the Cancer Support Community. So in 2009, the Wellness Community and Gilda's Club joined forces to become the Cancer Support Community, and through that merger, we now have over 50 affiliates, 100 satellite locations, and online programs where we provide social and emotional support to all people impacted by cancer. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. So on this slide, you'll see some of the resources that we offer nationally through our online services and over the phone. The first one listed there is our Cancer Support Helpline, which you can call from Monday through Friday, which is open from 9 a.m. to 9 p.m. Eastern Time. It's staffed by licensed professional counselors who are available to help and assist you. Also listed on this screen is our Cancer Experience Registry, which is a community of people who are touched by cancer. And the focus of our registry is on collecting and sharing information about the cancer experience and sharing those experiences with others. And we invite both patients and their family members to join. We actually also have a sub-registry that's specifically for those impacted by melanoma. So if you'd like to learn more about our registry, you can visit the link that is shown on the screen, www.cancerexperienceregistry.org. We also have our Open to Options program where you can sit down or speak over the phone with one of our specialists who can help you create a written list of questions about your concerns that you can bring to your next doctor appointment. And lastly, on this slide, we have our Frankly Speaking About Cancer program, which this webinar is a part of. Our Frankly Speaking About Cancer program is our national education series, which provides medical and psychosocial information to patients and their caregivers. So for this presentation, we'll be going over some of the financial concerns that come with managing out-of-pocket costs related to a melanoma diagnosis. So coping with financial concerns, potential out-of-pocket expenses that might come up, some practical tips and resources, and then, as I said earlier, we'll move into our question and answer session. It's now my pleasure to introduce our featured speakers, Joanna Morales and Angie Santangelo. Joanna Morales is CEO of Triage Cancer. She is a cancer rights attorney, author, and speaker, and has spent more than 19 years working on behalf of individuals with cancer. Joanna received a Juris Doctor from Loyola Law School, Los Angeles, and received her undergraduate degree from UCLA. Angie Santangelo, the Clinical Program Director at Cancer Support Community Central Ohio, is a licensed independent social worker with supervisory credentialing. She has been in the field of social work for 24 years, specializing in mental health issues related to chronic disease and trauma. She has worked both in the hospital and community setting. Angie is passionate about the mind-body connection and empowering people to help live the healthiest life they can. So at this time, I would like to pass the presentation over to Angie.
Thanks, Sri. I appreciate that. Welcome to the webinar, everyone. Talking about the financial impacts of anything is everyone's favorite topic. I know, and cancer is certainly on the top of the list of expensive treatment. Cancer care can be very expensive. Fortunately, there are new ways to get health insurance, and we are seeing many more people having health insurance today, which is a big relief. But we also know that health insurance doesn't cover all of the cost of care, and Cancer Support Community has done a survey, and nearly 70% of people acknowledge that they've had some unexpected expense during their cancer treatment. And when you're going through cancer treatment, you're already living on edge and often always just waiting for the next shoe to drop, and getting an unexpected bill or learning about a new expense that just hasn't been budgeted can have great emotional impact. And it's just one of those things that is not often thought about when someone is thinking about the emotional impact of cancer, but finances can definitely affect our emotions, and partly money can be very difficult to talk about, and often the healthcare team doesn't raise the issue with you in the doctor's office, and there's a couple reasons for that. Sometimes they are just unaware of the cost, and partly because every insurance is so different and it's impossible to know what one insurance will pay and one will not, and partly because they're so focused on getting your medical condition the best treatment that they can that they're not often stopping to think about the costs that you're going to receive during that time. But understanding your options is important, and learning to raise the questions with your medical team is very important. And we're very much an advocate of taking an empowerment approach towards the cost of care so that you can avoid problems and improve your quality of life. And so how are some ways that you can do that? Well, kind of back to stress is a natural response to the financial difficulties related to cancer. It can make it difficult to cope with your symptoms that you're experiencing from the cancer, from the treatment, and it can have a great impact on your quality of life. Can't count the number of times people have come and said in groups or individuals that they've just had sleepless nights just going over and over in their head their budget and how they're going to pay for this, and this bill came in, and how are they going to make the finances stretch, or if they get this medication that they need, how are they going to pay their car insurance or their groceries or those kind of things. And so these things often happen at night and often happen as you're trying to sleep, and when your sleep is impacted, your next day is impacted, and it just can be a snowball effect. Stress can also impair your judgment and negatively impact communication with your healthcare team and decision making. And so the most important step is to recognize the stress, to acknowledge it, and then to ask for help. And so once you're in a situation where you find your thoughts going over and over in your head about your finances, to just kind of take a minute and to take a deep breath and acknowledge it, and then take a step to ask for help. And again, we come back to the empowerment approach. Often when cancer enters our life, we can feel powerless, and part of what we at Cancer Support Community are about is teaching people that they can be empowered during this process. And the empowerment approach states that people with cancer who can actively participate in their recovery along with a healthcare team, and it will improve the quality of their life. The more that you take control of every area, and healthcare costs being one of them, the higher quality of life that you will have. Being empowered is important when it comes to paying for treatment and treatment-related issues. Information on these issues can be overwhelming, and unfortunately, avoiding these issues won't make them go away. And again, the number of times that we've heard participants, members in our groups just say, I don't want to think about it, there's too much else going on, I don't even know how to read the medical bill, I don't know what to do with this. Asking for help is a way to be empowered. You may not know the answers or what to do, but to reach out is a huge and important step, and to reach out to a trusted friend or family member who can help you and possibly even just take over this portion for you is a great idea. Ask your doctor to refer you to a social worker or a financial advisor or the case manager for that department. There is a person in the hospital who works with your insurance company and is fully aware of the cost and can help walk you through your bills and what you're paying. And if you ask your doctor, they can often put you in contact with that person. And if the doctor can't, they can refer you to a social worker, and the social worker will definitely be able to hook you up with the right person who can help you look through your medical bills and your EOBs and help to sort them out. There are many options available to help pay for care. Many organizations provide support to deal with financial matters related to cancer and all the potential life changes that cancer brings, and we'll be talking about some of those organizations later in the webinar. Some tips for reducing stress. Definitely, if it is affecting your sleep, if it's causing depression or anxiety, we would strongly recommend doing individual counseling, individual psychotherapy. It is often common that money causes tension in a relationship, and so couples counseling may also be an important step just to help deal with this issue. Support groups, like I've mentioned, support groups are a great place to come and to share the struggles with coping with the cost of care. And often this is a really great place because there's someone else who is just a little further along on the journey in front of you who has dealt with this issue and who can help. Just last month, and we have a renal cancer support group here in Columbus, and just last month there was an individual who found out about a payment option for a specific drug that many of the people in the group were taking. Many of the people were paying several $100s a month to take this medication, and the one member came in all excited, and she found a way to where they only had to pay $10 for this medication per month, and all of the members obviously benefited from that, and that benefit was able to go to all the group members because each of them was willing to share that this was a financial burden, and they were all aware of what was going on in each other's lives around the financial issue. And so it's just a great example of how a support group can make a huge difference, especially if you're willing to talk about the subject of money and finances at the support group. So medication is also an option if, again, if it becomes to the point of being out of control and talking either to support group or a counselor does not work. The counselor can often refer you to a psychiatrist or your medical doctor for medication. Cancer support community at all of our different affiliates offer mind-body stress reduction classes, and these, I can't say enough of how much that they can help to reduce stress. But being a part of a guided imagery or relaxation class or a mindfulness meditation class, these are all great ways to deal with anxiety. And not only does coming to the class and participating help you deal with anxiety, but all of these classes teach you techniques that you can do at home on your own, so that you can learn a mindfulness meditation in class, and then you can practice that same meditation at home when the stress comes up again. And these techniques can be so helpful. Other things, more physical, like the yoga and Tai Chi and Qigong, are also a great way to kind of center your mind and get your mind and body to work together to deal with anxiety. Expressive arts, whether it be music or cooking or drawing or painting, all of those things are a great way to channel anxiety, especially around the financial issues. Laughter, of course, is always the best medicine. There's just nothing that beats laughter. We offer a laughter yoga class here at our facility, and those are the happiest days around the office, because even if you're not in the class, you just can't help be affected by the laughter that comes out of the classroom. And it really does make a huge difference. Even if you start with a fake laugh and aren't feeling it, by the end of the time that you're here, you just can't help but be in a good mood. And it really does take that stress level from very high to very low. And so watching a funny movie or remembering an inside joke with a friend or family member, whatever it takes to give yourself a laugh, we definitely would encourage that as a tip to reduce stress. And then, of course, just any kind of movement, walking, swimming, anything that just gets you moving, just gets your body going, can be very helpful in reducing stress. And that completes my section. I'm going to turn this presentation over to Joanna at this time, and we will, any questions we'll take at the end.
Thanks, Angie. So even if you have insurance coverage, there may be potential out-of-pocket costs that you will have to pay as a result of your cancer diagnosis and treatment. And some of these out-of-pocket costs will be directly related to your medical care that you might expect, and some will be unexpected costs. And we're going to talk about some examples of both of these types of costs and give you some resources to deal with them. So starting with treatment-related costs, these are things that you should know about your health insurance coverage. Your insurance premium is what you pay monthly to have your insurance coverage. So even if you didn't get medical care all year long, you'd still have to pay your monthly premium just to have insurance. And then your deductible is an amount of money that you have to pay first before your insurance coverage kicks in and starts paying for your medical expenses. And deductibles are typically paid on an annual basis. So you pay it once at the beginning of the year when you have your first medical expense, and then you'd pay it again in the next year. Your coverage may include a deductible for your medical care, and it may include a separate deductible for your prescription drugs. And then copayments are usually fixed dollar amounts that you pay each time you get certain types of medical care. For example, you may have a $20 copayment for an office visit with your doctor, or you may have a $150 copayment if you visit the emergency room. And then there's something called coinsurance or cost share. And that's the difference between what the insurance company pays for your medical expenses and what you pay after you've paid your deductible. So if you have an 80-20 plan, then that means that your insurance company pays 80% of your medical expenses and you pay 20%. So Medicare would be an example of an 80-20 plan, but plans could be 90-10, 70-30, or even 60-40 as well. So as you're trying to manage what treatment expenses you'll have, you want to talk with your healthcare team who can help you figure it out. So even if you ask your oncologist, there might be a financial counselor or navigator or someone from the billing department that your oncologist would refer you to, and that person would be able to assist you. It's going to be a little bit different depending on where you get your medical care. You should also find out what the out-of-pocket maximum is on your policy. And this is a dollar amount that when you reach that amount of medical expense, then your insurance picks up 100% of your expenses. So for example, you may have a $6,000 out-of-pocket maximum. So to reach that amount, you add up what you pay for your deductible, plus any copayments that you make during the year, plus any coinsurance amounts that you've paid, and then you get to reach your deductible, and then at that point, your insurance kicks in at 100%. And what that does is it allows you to plan for a worst-case scenario of what you might have to pay for your out-of-pocket medical expenses during the year, but it gives you a cap on what those expenses would be. Now, it's important to realize that some plans have separate deductibles, copayments, and out-of-pocket maximums for prescription drugs. So the key to being empowered in this process is really getting to understand your insurance policy specifically and what it covers. So we also wanted to share with you some practical tips about how to manage medical expenses. And as I just said, the first is that you make sure that you understand your insurance coverage, whatever type of coverage that might be, whether you get private coverage through an employer policy or you buy one directly from an insurance company, or maybe you have Medicare or Medicaid. Understanding what your policy is going to cover and what your out-of-pocket expenses will be is your first step in trying to plan around that. You also want to try to keep track of your out-of-pocket maximum to make sure that they're crediting you for the payments that you're making so that as soon as you reach that out-of-pocket maximum, the insurance will kick in at 100%. You don't want to have to pay more out-of-pocket than you need to. It can help to get a notebook to record all of your expenses, your bills, conversations that you have either with your healthcare team around your bills or with your insurance company. You can keep track of appointments, exams, results, things like that, so that you can help to stay organized. When you do get your bills, you don't want to ignore them. You want to make sure to open them and review them carefully, because the bill process is just another human process, and there's possibility for human error. There's also possibility for computer error. So you want to make sure that you're actually being billed for care that you actually received and that you actually have to pay for. So make sure that you're reviewing your bills. You want to check them against your explanation of benefits or your EOB. And that's a piece of paper that you get from your insurance company that says what your insurance company is paying for that particular claim and what you're responsible for, if anything. And you want to make sure that what that EOB says matches with what the bill from your provider says. So that, again, you're not paying for things that are either incorrect or that don't match up. And if they don't match, ask questions of both your healthcare providers and the insurance company to figure out why they don't match up. So that, again, you're only paying what you are responsible for. So it might help to pick a day to be your healthcare bill day and pay your bills and do that bill review process. You might want to ask for help from family members or friends to go through that process. I've definitely had people tell me that they kind of make it a dinner, they cook dinner, and then they go through all the bills together. And then if you are needing to get pre-approval from your insurance company before getting certain types of medical care, you want to try to get those approvals in writing so that there isn't a point further down the road where the insurance company comes back and says, oh, we didn't approve that, because then you have a record of that. If for some reason you can't get the approval in writing, you want to make a note of who it was that you spoke with on the phone, their name, their contact information, date and time that you spoke with them, and what the approval actually said. You also want to make sure that you're keeping copies of all your documents related to your insurance claims, so copies of the bills, any payments that you're making, copies of your EOBs, so that if there's any question down the road, you have a record of everything that's happened. And you want to ask for help if you don't understand something. As Angie mentioned, your healthcare team can be a resource in that regard. So it might be the person in your provider's office that does billing, or it might be a social worker or a financial navigator or a case manager at your actual treatment facility. So there are people who you can tap to help you through this process. No one walks into a cancer diagnosis with an expertise in all of these topics, or certainly most people don't walk into a situation that way. So asking for help and for clarification is totally natural, and they expect you to ask questions. You can also request an insurance case manager from your insurance company. This is something that some insurance companies will provide you with, but it's important to remember that that insurance case manager can help you understand your bills and answer questions and maybe help you with appeals, but they do still work for the insurance company. So you want to make sure that you're still checking to make sure that your needs are being met in that process. And then oftentimes with insurance coverage, the system is set up to deny you the first time around. And you have to be empowered to not take no for an answer. Even though we're a culture where if someone says, no, you're not entitled to something, we take it. We accept that answer. And when we're talking about insurance, it really behooves us to not just take the no and to appeal denials. Because if you go through the appeals process, you're much more likely to get coverage for the care that you need. And again, your healthcare team can be a resource in the appeals process. But every insurance company has an internal appeals process, and every state is required to offer you an external appeals process, so that if your insurance company is still denying you coverage for your care, you can go to an external review organization within your state, and they'll review your request based on a standard of medical necessity. So that means that if what you're asking for is medically necessary, then they're likely to require the insurance company to cover it. So these are just some practical tips for managing medical expenses. But a cancer diagnosis can bring with it a variety of unexpected expenses. And while you may be focused on the cost of your actual medical care, there may be some additional areas that you'll want to think about so that you can best prepare and access resources that may be able to help you. For example, clinical trial expenses are just one type of treatment expense that's more specific. Clinical trials are part of a long and careful research process, and studies are done with patients to find out whether promising approaches to treatment are safe and effective. And if you're interested in participating in a clinical trial, there are additional questions that you should ask to determine which trials are available and the risks and benefits of participating in each trial. But there may be additional costs associated with the clinical trial depending on the trial and your insurance coverage. And these expenses are usually not more costly than the treatment that would be standard of care, but it's important to ask about these costs before you begin a clinical trial. And you're going to ask the healthcare professionals who are running the trial. Under the Affordable Care Act, which is also known as the ACA or healthcare reform, as of January 1st, 2014, insurance companies in every state are required to cover the cost of any routine care that you would have received during standard treatment. So that would include lab tests, office visits, blood work. However, some trials have added expenses that aren't routine. So, for example, and this is a big example, if the trial was asking you to take a PET scan every month, where standard of care would only be every 6 months, then you may be responsible for the costs of those additional tests. Now, some clinical trials may be out of state, so you may need to travel to participate in a clinical trial, meaning that you might have additional transportation or lodging expenses, and I'll talk more about that in just a minute. If your clinical trial providers are out of network, you want to ask your insurance company what it's going to cover. And again, engage your healthcare team to get more information about what other potential costs there might be for you. In addition, some states have additional protections for consumers, so you also want to go to your state insurance agency for information about your rights and options. And finally, if you have expenses that you're having difficulty paying for, there are financial assistance programs that might be able to help with your health insurance premiums, with co-pays, co-insurance amounts, deductibles, and other treatment-related expenses. Now, talking specifically about prescription costs, most insurance policies offer a prescription drug benefit. So they're going to cover some type of prescription drugs. And it's often managed by a company other than your insurance company. And there's usually rules about which pharmacies you can use or how to mail order your prescriptions. You have to use specific mail order companies in that case. There may be a different number for you to call about your prescription benefit information, so check your insurance card. And as always, when dealing with your insurance company, you want to keep careful notes of all of your communication with your insurance company. So each health insurance plan that covers prescription drugs has what's called a formulary, or a list of approved medications that they will cover. And formulary medications are usually ones that your doctor can prescribe for you without getting pre-approval or pre-authorization. And it's your insurance company, not your physician, who decides what's on the formulary. So when you are choosing a health insurance plan, you should be looking at the formulary list to make sure that your prescription drugs are on that formulary list. But realize that it is possible for those lists to change over time. So it's something that you want to stay on top of and make sure that that your drugs aren't being removed from the formulary. And if that is the case, then you might want to consider changing insurance companies. So if your provider provides a non-formulary medication, meaning that it's not on the list of covered drugs, you might want to talk to your healthcare provider about what your options are. So your healthcare provider might be able to prescribe you a drug that is an equivalent drug that is on the formulary list. You might also want to talk with your healthcare provider about appealing to your insurance company and asking the insurance company to make an exception to actually cover that particular drug. And there's something called off-label drug use, where a particular type of drug is approved by the FDA to treat one type of medical condition, but your doctor might be suggesting that it might be helpful for your type of medical condition. And so sometimes insurance companies have a process for asking for permission to be able to use a drug for that particular reason. And again, I already mentioned the process of appealing denials and that independent or external medical review process, which applies to prescription drugs the same way it does to other types of treatment that might be denied by your insurance company. There are also patient assistance programs to help with the cost of your prescriptions, and you shouldn't assume that you wouldn't qualify for one of these programs because assistance might be available even if you don't have a low income, or if you have no prescription drug coverage or limited prescription drug coverage, you might be able to get assistance. Or if you can't afford your copays, you might be able to get help with that. And if you are on Medicare Part D and you're in the donut hole, which is a gap in coverage, you might be able to qualify for assistance with prescription drugs. And so this is a slide that has a number of potential resources that can help you with obtaining your medications. So Cancer Care, HealthWell Foundation, Needy Meds, the Patient Advocate Foundation, and the Patient Access Network Foundation can all be resources. Now, you may also have psychotherapy and counseling expenses that you didn't anticipate or didn't think about. And so it's important that you get the psychosocial support that you need, as Angie mentioned. And insurance companies are required to cover mental health care as an essential health benefit under the Affordable Care Act. So previously, many insurance policies didn't cover mental health care. Now, insurance coverage can still vary based on the plan that you have, so it's important to check what your plan charges for copays, coinsurance amounts, and out-of-network costs related to mental health care specifically. And you can either contact your insurance company or ask your healthcare team about what your policy covers, what costs you might have, and whether or not you have to get pre-authorizations or referrals to specific mental health providers. If you need help finding support, you can ask your healthcare team or you can call the Cancer Support Community's Cancer Support Helpline at 1-888-793-9355. Some other types of unexpected treatment expenses include private duty care, long-term care, and custodial care expenses. So private duty or custodial care can help you with transportation to medical appointments, can help you with preparing meals, and other types of daily living chores. Long-term care is extended care at a nursing home or other specialized facility. So they're slightly different in their definition. And depending on your insurance coverage, you might be able to get help paying for some of these services. But there is a difference between health insurance and long-term care insurance. Long-term care insurance generally only covers expenses that are not covered by health insurance. So long-term care insurance generally covers home care, assisted living, adult daycare, respite care, hospice care, nursing home, and some Alzheimer's facilities. Now, Medicaid and Medicare can both offer some coverage for some of these types of services, but the rules vary, so it's important to contact the Medicaid program in your state, or you can call Medicare at 1-800-MEDICARE or visit medicaid.gov or medicare.gov online. You may also have a supplemental insurance plan, such as a cancer plan, which may provide some additional benefits that cover some of these expenses. And again, a running theme is to engage your healthcare team as they might be aware of valuable local resources for you. And you may be in a position where you need more help to be cared for while you're in treatment especially. So how do you find someone to help you, and how do you pay for that? Certainly your family members and friends may be able to help. MyLifeline.org has a calendar tool where people in your support network can actually go on and sign up to help you with meals or other types of caregiving needs, maybe driving you to the grocery store to shop for groceries or to take you to appointments. You can ask your healthcare team for local resources. And family members might actually get paid to serve as your caregiver. So this is an option through your state Medicaid program. It's slightly different in every state, and every state's program has a different name. So for example, in California, it's called In-Home Support Services, whereas in Texas, it's called the Family Care Program. And family members can actually provide some of the caregiving services for you and get paid by the state to do that. Now, getting to and from treatment, whether it's local or cross-country, may pose some challenges and cause additional expense. For example, if you're not able to drive during your treatment for whatever the reason might be, then you may need some help getting to and from treatment. If you have daily treatment or ongoing follow-up appointments or medical tests, then that's going to add to that challenge. And if you live in a city where public transportation is great and you may not have a car, is it still possible for you to continue to commute on public transportation if you're in treatment with a weakened immune system? Even paying for parking at your treatment facility can get expensive, depending on where you go, and certainly the price of gas can be challenging for everyone. So staying on track to make all of your appointments might seem impossible sometimes, but you can engage your healthcare team and your family and friends to help support you. So your healthcare team might have local resources available related to transportation. Your family and friends might be able to donate their airline miles and hotel points if you have to travel outside of your local area for treatment. And some types of health insurance can actually cover transportation expenses. And again, if you have supplemental insurance, such as a cancer plan, it may cover travel and lodging expenses. You might also want to talk with your tax preparer about which of these expenses might be tax deductible and what kinds of records you have to keep for your taxes. These are some additional resources that can provide assistance with transportation and lodging related to treatment. There are national resources such as the American Cancer Society, which provides a transportation assistance program called Road to Recovery. And they have lodging available through their Hope Lodges around the country. They're located near cancer centers across the country. And then for air travel assistance, there are a few different programs which provide flight assistance. We've listed just a few of them. So the Corporate Angel Network, Lifeline Pilots, the National Patient Travel Center, and Patient Airlift Services all provide information on how to get assistance with air travel related to treatment. And Joe's House provides a list of lodging programs for people who have to stay away from home while they're getting care. While you're in treatment, the world doesn't stop around you, so figuring out how to keep up might be rough. You may need to take time off work or figure out how to balance child care or elder care for a parent, and some days you might need help cooking dinner or cleaning the house. You may also face some additional expenses with addressing comfort and cosmetic side effects of treatment. But there are resources to help with all of these issues. To learn more about taking time off work, the Family and Medical Leave Act, or disability insurance, you can visit triagecancer.org. And no surprise, we recommend asking your healthcare team about local resources. But you should also think creatively about these expenses. For example, utility companies usually have a discount program. And depending on your income level, if you can get help with your utilities, then you can use the money that you would have spent on your utilities to pay for some other expense that you might have. So again, being creative and shifting expenses might be helpful. So these are some additional resources that can help with daily living expenses. For example, the American Cancer Society has a program called Look Good, Feel Better, which addresses some of the cosmetic and comfort side effects of treatment, including wig donations, if that's something that you need. There are also a number of different programs that can help with meals, from the Supplement Nutrition Assistance Program to Meals on Wheels and home delivery of meals. There are a number of different resources there. And then Cleaning for a Reason and Comfort Tree are both programs to help people with cleaning their homes who are in cancer treatment. And the final area of unexpected treatment expenses that may come up are legal expenses. However, there are many programs in the cancer community that can provide information about your rights and options that are free of charge. If you do find that you need actual legal representation, then lawhelp.org can help you find free or low-cost services in your area, and you can narrow it down based on the area of law that you're looking for assistance in. You can also contact your local, state, or county bar association, which is a legal membership association in your community. Many of those associations have lawyer referral services. Some of them also have pro bono legal assistance programs where they provide free or very low-cost legal services. So those might be options to get access to attorneys who can assist you. For questions related to employment rights and cancer in the workplace, I recommend contacting Cancer and Careers.
Joanna? Joanna, I think we lost your audio. Just to the audience, bear with us for a couple minutes. Joanna?
Sorry? Yes.
Sorry, we just lost your audio for a couple minutes there.
Oh, so was it just on this slide?
It was at the end of the last one.
Okay.
Yep. Just the resources.
So if you are finding yourself in a position where you have questions about your legal rights and you are actually looking for legal representation, then lawhelp.org is a website that can help you find free or low-cost legal services in your area based on your county. In addition, they can provide legal information about a variety of different topics on their website. And you can also contact your local, state, or county bar association, which is a membership organization for attorneys, but those associations often have lawyer referral services where they can make referrals to different attorneys who practice different areas of the law. And those lawyer referral service programs also often have pro bono programs where they provide free or low-cost legal assistance on a variety of topics. So those might be good ways to get referrals to attorneys who can assist you depending on the area of law that you're looking for help in. And then related to employment and cancer in the workplace, Cancer and Careers is an excellent resource for questions related to working through treatment, taking time off, or looking for new work after a cancer diagnosis. And Triage Cancer can provide information on health insurance options and access to government benefits and disability benefits. So this last slide provides additional resources who can help with a number of areas that we've talked about today. And at this point, I will turn it back over to you for questions.
Great, thank you. Thank you, Joanna, and thank you, Angie, for your presentation. So now I would just like to turn the presentation over to the audience, and if you have any questions for any of our speakers today, please feel free to submit those in the Q&A box, which is found on the right of your screen. So we'll wait a couple minutes for you to enter those questions in. Okay, Joanna, it says, where can I find out specific information regarding filing my medical-related expenses, including child care, transportation, wigs, etc., with my taxes?
So if you're looking for what the tax deductions that might be available to you are, you can go to the IRS website, which is irs.gov. If you search for medical-related deductions, it comes up with a full list of the type of deductions that you're able to take. And I would certainly recommend talking with an accountant or a tax preparer. There are companies that prepare taxes if you don't have an accountant already. But I would definitely recommend asking those questions and getting more information, because that can actually be a significant deduction for you on your taxes.
Great. Our next question is also for you, Joanna. If I am required to provide some financial piece of my clinical trial, will this expense be deductible?
Any of your out-of-pocket medical expenses, regardless of the type of medical care that you're receiving, can be tax deductible, but it depends on the amount of overall expenses that you have during the year. And again, I would refer you to your tax preparer because you can deduct your medical expenses if they reach a certain percentage of your overall income. And so a tax preparer can explain that in greater detail.
And our next question is, what is meant by appeal denials? And are there templates available on how to appeal?
So when I say appeal denials, if you are asking for your insurance company to pay for a surgery, for example, or a chemotherapy treatment, and your insurance company comes back and says, we're not going to cover that, or maybe we'll only cover 20% of that when you think they should be covering 80% of that, then you can actually appeal that decision. And every insurance company has an internal appeals process, and then under the Affordable Care Act, every state has to have an external appeals process. So generally, on a practical level, how that looks is your insurance company says, no, we're not going to pay for something. You go back to them and say, I'd like you to look at this again. And usually when they send you the denial or your explanation of benefits, it includes information on how to appeal. So there's usually a step-by-step process that's laid out for you. They're required to explain it to you. So it's usually right there with the denial. So you ask them to take a look at it again, and if the insurance company says no again, they might have another level of appeal internally. But if they still say no at that point, then you can go outside the insurance company to what's called an independent or external medical review organization, which is usually a process run through your state's insurance agency. And you ask them for help. You say, I'd like you to take a look. My insurance company is saying that they're not going to cover this. I think that they should be. My doctor is saying it's medically necessary for me to get this surgery or chemotherapy treatment, but they're not covering it. And so they review your medical records, they review your request, any documentation from your healthcare team, and then they make a decision. And in most cases, that decision is binding on the insurance company so that they'll have to pay for it. So hopefully that explains the appeals process. If you want more in-depth information, there's 2 places you can go. You can go to healthcare.gov and in the search box, put in external medical review, or you can go directly to your state's insurance agency for your state-specific appeals process information. So if you want to find your state's insurance agency, Google is a good tool, or you can go to Triage Cancer's website, and on our state resources page, we've listed all the state insurance agencies.
Okay, great, thank you. So we have another question here about Medicare. It says Medicare doesn't pay for TSH testing, which is required. Why isn't there a code from Medicare to cover the required TSH testing? We've appealed 3 times for each denial. Any insight on that or any other resources that you think might be available to them?
So Medicare is a little bit different than private insurance, and that external appeals process that I was just referring to is for private insurance. So I'm glad you asked that question, which allows me to clarify. Medicare has its own appeals process. I don't think that I could say why Medicare has chosen not to provide that coverage. I think working with your healthcare team to document why it's medically necessary so that you don't have to appeal the decision every time it gets denied if it's a test that you need on an ongoing basis. Those would be my only suggestions. I think you could also certainly talk to, this sounds a little grandiose, but you could actually talk to your elected officials about this. HHS does make decisions related to coverage on an ongoing basis, and so engaging the Centers for Medicaid and Medicare Services and HHS in making administrative decisions about other things to cover is part of the process. And so that's actually how the list of things that get covered get expanded. It's because people bring to their attention practical challenges related to medical care, and then they make changes to the coverage. So I think sharing the challenges that you're having with your elected officials and with CMS and HHS and your healthcare team are all important steps to take. I know that just adds one more thing to your list of things to do, but that's the only way to change the system.
Great, thanks for that clarification. If there are any other questions at this time, please submit them. I'll give it a couple more seconds. All right, so we have no further questions at this time, so I just want to end by saying thank you to all of our attendees for your questions and enthusiasm throughout today's presentation. If you'd like more detailed information on finances or cost, please feel free to visit our website or call CSC's toll-free helpline. Again, we'd like to thank our wonderful speakers, Angie and Joanna, for contributing their time and sharing this important information with us. We'd also like to thank our partners, AIM at Melanoma, Melanoma International Foundation, Melanoma Research Alliance, and Melanoma Research Foundation. And we'd also like to thank our program supporter, Merck. At this time, you will now be redirected to our post-webinar survey. It's a brief survey, and we appreciate any feedback that you have for us. I hope you all have a great evening, and thank you for joining.